Okay guys, so today we want to talk about preventing carpal tunnel and a few things you want to start to understand about carpal tunnel. Basically, if you're getting any symptoms, you're usually there through the hand. You can get sort of pins and needles or numbness, very much thumb, second finger, third finger, and then sometimes sort of half of that fourth finger. Very commonly we'll see it in those two fingers. You're getting sort of pain and numbness. Pregnant people, people that are doing overuse types of issues, so heavy work, typing, anything like that, oftentimes they'll be more tender at night, and in the morning they're nasty as well. If you're finding that you're sort of shaking your hand and that's helping, then you're probably looking at having carpal tunnel. So you want to be aware of those symptoms. The gist being, you want to try and prevent these things from coming on. And what I find when I look at people is that I've never ever found anyone with just a pure carpal tunnel without any associated sort of tension and tightness leading down into the area. So you want to start to address all of those, because if mechanics wise you can help yourself as much as possible, then you're going to get through life pain free. So one of the other little quick tests that you can use, just if you're thinking that you might have carpal tunnel symptoms, is your Phalen's test. So do you want to just go into that? So basically, if I thought it was in this hand, we can just hold into this Phalen's test, so holding it at 90 degrees, and we're basically putting pressure on that median nerve through there. So if you're getting any tingling or pins and needles, or it's increasing your pain, then obviously you've got to get to doc. You should really check with your doctor or your healthcare professional about these things. Cool. So the other thing you want to be aware of when you're trying to prevent these, trying to ease these things off, is that infraspinatus here, there's a little trigger point in here that can very much refer pain in a carpal tunnel type of distribution. So that point will refer pain through front of shoulder, dampen off over elbow, and then head into the thumb as well. So be aware of that. You want to start using your SSTM strategies to try and release that. What you can also do is start to think of your mechanics leading in, and pec stretches are a really good idea, so get into those guys. We'll just get Philippa just to show you a quick pec stretch. Come so we can see the yeah. So we're again sort of doing those low fibres through the pec there. We can change and we can come down and do more the middle or higher fibres, getting at the stretch through there. So really good to start incorporating simple stuff like this into your training routines, into your work days as well. The other real quick little thing that I'll show you is a median nerve stretch, because the carpal tunnel is a little tunnel of in between the wrist, and the median nerve runs through there. It gets impinged and gives you those symptoms. So you can start to do median nerve glides. So we'll just get Philippa just to go out to the side, wrist back. And because it's a glide, it's a nerve glide, we're not going to sit on that for too long, so about 2-3 seconds, and then relax off. Yeah, and then out again. So if you think of it like a piece of dental floss, you're starting to move that tissue through and starting to keep it running through nicely, decrease your inflammation in that sensitive area. So a couple of simple little things that you can start to do. Always try and be preventive. If you do have subtle little symptoms, talk with your doctor, talk with your healthcare professional, and start to utilise a home program where you ease tension, free muscles up, and stay fit and healthy. So in conjunction with that, you should also start to understand the real specific tightness leading into that type of area. And I always like you to start thinking about your rules of muscles, your squeeze, stretch, trigger, move. Start using your SSTM programs every day.